Hello there. Happy St. Patrick's Day. I am super excited because I am going live with amazing psychologist from our team today. So I just invited her in, Dr. Melissa Matos. And so when she joins us, we're going to talk all things psychology and our integrated team here at Re+active. If we have not met, my name is Julie Hirschberg. I'm the owner, founder of Re+active Therapy and Wellness here in the Los Angeles area, and very proud to be a part of what Re+active is doing, and particularly in our integrated teams. I shared today that, we started 11 plus years ago with myself and one patient. And here we are now. We've got a team of 25 people, and there's Melissa. I'm going to just make sure she can get in here. Growing psychology team. It's been a huge part of what we do at Re+active. So let me just check here if I can get Melissa on. Just inviting her one more time. Sometimes technology. Yay! Hi, Melissa.
Hi.
It's good to see you. This is so perfect because I literally just stepped out of one of our integrated team meetings with our team and into this. And I was like, I gotta go, everyone. I'm gonna go talk to Melissa. So thank you for joining me today. I've been wanting to do this for a while to introduce the world to our team, particularly because you have taught me so much in this field. And so I want to introduce you to everybody, Re+active world. This is Dr. Melissa Matos, and she is only on our team for a few hours a week, but it has made such an impact on our team and for our patients. And Melissa, you are the first person that I met with a specialty of rehabilitation psychologist. And I know a lot of people maybe don't know what that means. So that was the first question that I had to you is, what is that exactly?
Yeah, so I'm so happy to be here, and I'm always happy to be working with Re+active. It's one of the highlights of my week, to be honest, particularly because of the integrated care. And Re+active, I will say, is one of the very, 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 very few outpatient settings where you have what seems to be like true blue integrated rehab PMR type of care. And that's very hard to find in an outpatient setting. So it's definitely one of my favorite things to do. Just putting that out there. But yeah, so what is rehabilitation psychology? Most people don't know. Even most clinical psychologists and counseling psychologists don't know what rehabilitation psychology is. I think when most people hear rehab psychology, they typically think substance use treatment. And while that can be a component of what we do, it's certainly not the main part of what we do. Rehab psychologists, if you think about physical medicine and rehab, I think that really would be the best way to describe us. So rehab psychologists typically so the field of rehab psychology is a subspecialty within professional psychology. So we are applying all of the skills, clinical skills, knowledge, principles from oftentimes even clinical psychology, but professional psychology, to individuals that are living with disabilities and chronic health conditions. And the focus for us is often, how do we optimize adjustment and adaptation to living with a chronic health condition or a disability? And that includes acquired or congenital disabilities or chronic health conditions. Anytime there's some type of change in your functioning, and that could be all domains of functioning, rehab psychologists are usually embedded in a team, and we are helping you adjust, adapt, and also reintegrate back into the community and your social roles. Those social roles sometimes change once you've had a chronic health condition or disability. And it's not only a change for the individual, it's a change for them and their family. And so rehab psychologists provide support for everyone in your treatment team, but also in your own personal team at home. And how do you navigate these changes? So that's most of what rehab psychologists do. There's a lot within that specialty areas that we also do as well, but that's the gist.
Yeah, that's really helpful though, because I we've worked with neuropsychology, and that's how we connected with you, because you also have worked with Dr. Lauren Keats, who is our neuropsychologist. And many of, me personally, I work with my own psychologist, and they have, their approach too, but never this idea of rehabilitation and really that understanding of what a person who might be going through a major functional life change, and how that's impacting their life. And one of the things that I've really appreciated, Melissa, is your understanding and advocacy too for understanding what is life with a person with chronic conditions or disability. And I wonder if you can just chat about that a little bit, because I think you really are such a great advocate. And I think you've really helped us understand as well some of the ideas of disability and ableism in rehab.
I think that's also one of the things that makes rehab psychologists a little distinct, and certainly not just rehab psychologists. I think psychologists across the spectrum, certainly, but it's the role of advocacy. When I'm working with trainees, when I'm a supervisor, I'm always letting them know that psychologists wear a lot of hats, but I think we forget that we're advocates, and we're advocates or when we talk about the affirmative model of disability, which is that disability, taking this non-tragic view of disability, that it's just a diverse identity, that it's a difference that has its own strengths. And how do we view that as a distinct identity? It's a part of who you are, and not necessarily a limitation, not necessarily a deficit, but what are the strengths that come from that? And they borrow a lot from the social model of disability. And the social model of disability says, disability is not a deficit, right? I think many people think that when they have a chronic health condition or disability, and I hear this a lot with my patients, is something's wrong with me, right? And it's because we live in a world, in a society, that most of the people that make the rules and design the buildings and transportation and decide how we work and how we go to school, it's usually people that are able-bodied. So it's an ableist society. And so if you're going through that world with a disability, you start to feel that, it's inherently in me. I'm the person with the deficit. It's not. Society was just constructed that way. That if we had a universal design, it wouldn't be a deficit. It would just be a difference. It's a difference that should be celebrated. So I think that perspective is a little bit different to rehab psychologists, and we bring that into the approach we use. So I use all the same evidence-based practices that my colleagues do, CBT, dialectical behavioral therapy, acceptance and commitment therapy, but I usually do that within a disability affirmative approach because it's really important to the patient population that we're working with.
Yeah, I love that. I love what you brought to our team and to the people that we get to work with, in that just added layer of understanding and advocacy. And I just love having you on our team. And I love like this. I could do it all day, is meet with our team. And like I said, I just came out of one of our integrated team meetings. This is for a client who's here doing an intensive program. And here we are. I mean, by the time we were done, had all these creative ideas of painting things on the wall, that can only come by like brilliant minds getting together. It's so great. When having psychology on that team is just like a game changer. I've learned so much from you. Acceptance and commitment therapy, just understanding a person and where they're coming from. And I would really want to hear from you, like, tell me what it's like working on that integrated team, what you see in the role of psychology in that team and working with the other professionals.
Yeah, not to just keep going on about rehab psych, obviously I'm biased, but I think that's a big part of what we do too, is the interdisciplinary work. That it's a competency if you get boarded, is interdisciplinary component and interdisciplinary in consultation. Most of us are trained the same way you were, Julie, in an inpatient setting. And we're almost always on teams. Most of my training, most of my clinical work that I, like the last several years, I'm always on a team. It's weird for me actually to be alone, because I end up making my own team and like finding people to kind of start consulting with. Like, listen, let's work together. So as a psychologist, I'm so used to being on a team. And the line I use again and again, and I'll keep using it, is that a patient is not one-dimensional, that their team shouldn't be either. Their team should be multidimensional, and we should all be working together. And as a psychologist, I find that that's the best comprehensive care. I'm helping the team understand the patient from their psychosocial standpoint. I'm also, like, I love learning from my colleagues as well. I learn, you know, you said you've learned from me, but I learned from you all so much. I think and I'm always really impressed by OT and PT, and when we have like KT, or when we have speech, my nursing colleagues, and social work, when social work is around as well. So I find that the best care is when it's integrated, and we're always touching base, and we're always talking to one another, and we're learning from each other, and that work not only keeps everybody on the same page, but then you have this coordinated care that seems cohesive. It doesn't feel like, well, your doctor's saying one thing, but then the nurse said something else, but then, you know, PT said this, and then the psychologist. Everybody's all over. The clinic, the patient is confused, and usually the outcomes and the goals are just they're not very effective, and it's not very successful. So I feel most comfortable on a team. I find that it tends to be the most successful. And I also find that it's not just for the patient. Sometimes it's just for the team. That the team, particularly when you're working with someone who may have some really difficult psychological issues, or family issues, or behaviors that may be getting in the way of treatment, and the team sometimes is just so overwhelmed that sometimes it's not even for the patient, it's really just for the team, that I find myself providing the most support.
Yeah. Well, I'm on the receiving end of that support. I know our team is too. And that has definitely been part of it. I mean, you know, having been at Re+active for a little while now, we primarily work with pretty complex cases that have multiple pieces of their medical history, personal history, that are all part of the journey that they're on, all part of the story. And I think you said it so well, in that, like, people are not unidimensional. They're not just a physical body, which is like, I mean, I don't think I've ever just been concerned with the physical body as a physical therapist, but it's not just physical. It's not just mental. It's this, you know, really multidimensional approach, and being able to integrate those pieces together and hear from each other. And then I can take, oh, like, you had a really interesting insight, and I can bring that into what we're doing as we build a walking program, or we can create combined goals together. And I think one of the biggest things then, as I started this in talking about complex cases, is that when I started Re+active, like, me and my lone self and a patient, I didn't have a team. And I saw complex cases from the beginning, because that was what I was kind of known for and did all of the time. And often I was kind of thrust into that role where, and I'm not a psychologist, right? But I'm trying to help that person, even if it's connecting them to somebody or a resource or this or that. And it's really challenging to do when you're not in that role. So to have a team approach it's been like a life changer for me. And I know both of us came from backgrounds and we're always been on a team. And like you said, like, I'm just going to make that team. Yeah. And that's kind of what happened with Re+active, is like, I made the team that my patients really needed to be seen as a whole person, and that I really needed so that I could be the best PT for that person, and learn from other disciplines. And I'm so thankful for you.
Oh, it's so important. And not only are we learning from each other, but I do feel that the care is just so much more cohesive. And it's also nice to have that support. I think sometimes it's nice to have your team members as well, to just say, well, I'm feeling really like stuck. or I'm feeling like I feel like maybe I'm just not helping this patient, and to hear someone say, I've also noticed that I'm also feeling that way. Let's all meet together. Let's have a discussion, and maybe, you know, team meetings with the patient as well. Let's all meet together with the patient. Maybe we can all strategize together. There's just something so powerful in having that support and having all those people invested in the treatment and in that patient. I just find that it's the most successful.
Yeah, I agree. Well, and that's how we found you, and how we have you as a part of Reactive. I think our mission and desire to have that team for ourselves and for our patients really drew us together. And in many ways, I think that is, you know, a lot of people have asked me, well, like, how did you build this team? And it's not like I put together a business plan and said, I will have a neuropsychologist and I will have a rehab psychologist and I will, you know, put up an ad and find them. It's like happens so organically. And I think in a way it starts with having that kind of common like mission of a type of care that we're looking to provide. So that's one of the things that I'll share with people is like, you'll start finding those people because they will find you too. Just like you said, you found your people, and you find them. You find those that have a common mission of seeing and treating a person as a whole.
I think that's one of the benefits is sometimes in a more inpatient medical setting, you don't have that. It's that it is more the traditional, everybody just applied and now we're all on this team and we're all working together. But in a setting like Reactive, you do have that opportunity where you're looking for a team that shares the same values and the same mission that you mentioned. That makes a huge, huge difference. And I think that's why when we do the integrated meetings, it feels very fluid. It feels everyone's on the same page, everyone's invested, and it feels very natural and very comfortable, and then as a result the outcomes are very successful that way as well, and I think our patients benefit.
Yeah, I agree. Well, Melissa, I want to thank you so much for hopping on here with me for a little bit tonight. I know we both are running off to our next things as well. So I know you have a client and I have a student. So thank you so much for joining me. I think this was really helpful to share with the world what we do, why we do it, and why it's helpful for people. So thank you.
Absolutely. Of course. Thank you so much.
Okay. I'll see you soon.
Bye.
Bye.